Hello, everyone, and welcome back to the community table. We have been having conversations every month here at Beyond Type 1, focusing on critical issues faced by the entire diabetes community. And tonight is no exception. We're talking about why language matters, another undeniably crucial topic. I'm Jordan, the Director of Programs at Beyond Type 1, and I will hand it off in just a second to our awesome panelists. But first, I just want to thank all of you, as always, who are joining us here tonight in Zoom and on Facebook Live, as well as those who make our conversations at the community table a possibility. Community Table is presented by the JDRF-Beyond Type 1 Alliance and made possible with support from Abbott Diabetes Care, Dexcom, Lilly Diabetes, MannKind, Medtronic, Omnipod, Roche Diabetes Care, and Tandem. While you're watching tonight, if you have questions for this group, we will do our best to take those as always later on in the discussion. So please feel free to drop them into the chat if you're on Zoom or into the comments if you're on Facebook, and we will do our absolute best to get to those. For now, I'm going to ask our awesome panelists to go ahead and come on video, and I'm going to hand it off to Sarah, who is going to be moderating this conversation tonight. Sarah, please feel free to take it away.
Thanks so much, Jordan. Hi, everyone. Welcome also again to the community table here on behalf of Beyond Type 1. And tonight we will be having a conversation around why language matters. We're really excited to get started with this topic, but a little bit of background before we begin. Hashtag Language Matters began as a concept in conversations and on social media and has become a movement anchored by the idea that the language healthcare providers and others use has a major impact on people living with diabetes. We owe all of the thought leaders around the world that have contributed to this movement, including, of course, the ones we have with us tonight, a debt of gratitude, as it allows us to have conversations like these. So thank you all. I should say, and get started with the fact that my name is Sarah Mart, and I work for a nonprofit in the United States called Diabetes Sisters. And I will tell you a little bit in a moment about my own journey with diabetes. But I'd like to open that up as the first question for our panelists this evening. For those of you who are living with diabetes, would you share briefly about your journey and what that's been like for you? Renza, would you care to go first?
Thanks so much, Sarah, and thanks so much for having me here. Before I start, I'd like to acknowledge the traditional owners. I am on beautiful Wurundjeri land in Melbourne, Australia, and I'd like to pay my respects to their elders, past, present, and emerging. Yes, I live with type 1 diabetes. I was diagnosed 23 and a bit years ago. I was diagnosed in Melbourne. It's where I live. And I guess my story is a really wonderfully untraumatic diagnosis. I had symptoms, went to my GP, she sent me to have a blood test, and I was diagnosed a few days later. But I do remember my diagnosis day because I remember the words of my GP when she diagnosed me, and she dropped the F-bomb and said, "You have type 1 diabetes." And I had no idea what that meant. But she sent me off to see an endocrinologist that day. She picked up the phone, made an appointment for me, and I went to see a private endocrinologist that day. And I can still remember the threats and the way that he described diabetes and the images that he showed me. He was lovely. He was really nice. But, you know, that story of being told, if you don't do what I tell you, you're going to do all of these bad things are going to happen and it's going to be your fault. And that stuck with me. And it really, I guess, in a lot of ways, almost paralyzed me with fear for a very long time. So I'm very passionate about how we communicate about diabetes. It's really something that I, you know, am very pleased to be talking about today, and something that I've been pleased to be a part of, I guess, for quite a while. So thanks again for having me here.
Definitely. Thanks. CJ, how about you?
Hi, I'm great. Thank you for having me. My name is CJ Walker, and I'm actually a type 2. I was diagnosed with type 2 diabetes back in 2019, so it's almost 3 years, and it was unexpected, although I did have a family history on both sides. I was at a doctor's appointment for a follow-up, and lo and behold, my blood sugar was 300, did a follow-up, and that's when I was diagnosed with type 2 diabetes. I quickly sprung into action, changed my lifestyle, my diet, physical activity, and right now I am doing well. My numbers are in range, and I'm really prioritizing myself and my needs to make sure that I'm taking care of myself and managing diabetes. And what I do is encourage others to do the same. I run a blog called The Genetic Diabetic, and I also am a freelance writer for diabetes on several websites. So I'm just really happy to be here and being able to talk and discuss about diabetes and language and how that affects us.
Awesome. Okay. So I should say a little more about myself, I guess. I was diagnosed 41 years ago in the days of chemistry sets with our own urine in the bathroom to see what our sugar levels might have been 4 or 8 hours ago or what have you. My lived expertise includes using an insulin pump of various sorts for more than 35 years. A continuous glucose monitor for 12 years. And just last week, I had my 4-year anniversary of using a do-it-yourself artificial pancreas system called Loop, which I'm sure many of you know about. And I didn't even realize that until was thinking about what to say for tonight. So 4 years ago. And I've also used a variety of different types of oral or injected meds for diabetes off-label over the last 20 years or so. I grew up with diabetes in the state of Montana and was so lucky to realize and be able to find community at a diabetes camp when I was growing up there. So for 1 week each summer, I got to feel what it was like to be quote unquote normal. And I don't like that word in terms of diabetes and people living with diabetes. But it did truly feel that way with, 100 other kids and adults there who were just like me. And I also realized that that was the first place where I heard people with diabetes versus the word diabetic from a certified diabetes educator, CDE, who did not live with diabetes. And that was in 1985. So it just occurred to me again this week that this work, this language matters, and this attempting to shift the narratives going on around diabetes around the world has been going on for so long, and there's so much more still to do. But there's some really incredible things that have been happening. In terms of Diabetes Sisters, my organization that I work for, I oversee programs there for women ages 18 to 104 plus living with any type of diabetes. So our programs include peer support groups that meet monthly, leadership training for our volunteers, and events and resources with and for women of color living with diabetes. So that's a little bit about me. I am not seeing any other panelists at the moment, so I'm just going to jump right in and we'll go ahead with the questions that we have for all of us. So from your perspectives, why is language so critical when it comes to care and well-being for people living with diabetes? CJ, what do you think?
So for me, language is more than just words. There's times where it also means how you say things, how you write things, and depending on how you choose to use that language and how you talk to patients living with diabetes, that can either motivate them or it can tear them down. And if a person with diabetes is torn down, then chances are they're not going to really be able to manage their diabetes the best way that they can. So choosing your language is very, very important, because that can either make or break how they manage their diabetes.
Totally. Yeah. Renza, what would you add to that?
Yeah, I think CJ's point there about it's more than just words is really, really important. I actually gave a talk about language this morning. I feel like a one-trick pony. It's all I talk about. It's not. I've got so much more to talk about. But I actually changed the heading from language matters to communication matters, because it is more than just words. And I think sometimes we get bogged down in individual words, which actually does a real disservice to this whole movement. And it is a movement. I really think, I really do believe that. But you know, and one of the first slides that I do now when I'm talking about language is, let's just get this over and done with right now, the diabetic versus people with diabetes thing, because I feel like that just becomes the focus, and then people go, well, I don't care, I'm this one, and that's not it at all. It is part of it, but it's not the whole thing. People with diabetes are free to refer to themselves and their diabetes any way they want. Any way they want. It's not about tone policing people with diabetes. And I get really annoyed when I hear health professionals say, don't call yourself a diabetic, you're more than that. Well, you know what? I can call myself whatever I want. It's not about the language we use ourselves. But that communication bit is really important. It's about images. It's about the pictures that we use when we're talking diabetes. It's about the tone we use, or that, you know, others use talking about diabetes. It's about attitudes, because those attitudes create our realities. So I think that that's why it is so important. I work for Diabetes Australia. We launched the first position statement around language 10 years ago. And that was not because Diabetes Australia went, hey, this is important. It was very much a reflection of what was being discussed in the diabetes community. And we wanted to capture that and support it with some research to show, actually, it's not just about political correctness. It's not because we're all just precious flowers and don't be mean to us. It's about a lot more than that. And so that's why it's just so critically important to me.
Totally. I was thinking about like every moment of potential engagement that we have with someone, whether that's a healthcare provider or a colleague or a loved one or a stranger in the coffee shop about this condition, is an opportunity for us to receive. And so much of the time, I think, you know, we think about like, well, how are we going to tell somebody? How are we going to tell our doctor, whatever? But it's an opportunity for us to receive either respectful connection or shame and blame about diabetes. And it just, you know, blows my mind, like, which will it be? That's like a constant thing that we're all going through. And I think, I don't know what you all think, but I think we know that, even if we don't like consciously recognize it. And it's just like one more layer of stuff.
Yeah.
It's huge, huge stuff, but yeah.
I find myself when somebody starts to talk, you know, that if they see my CGM or whatever, and they, you know, it's a stranger and they start to talk diabetes, I almost feel like I get a bit defensive, because I'm like, oh, how is this going to go? How is this going to be? Is it going to be they're throwing stigma and blame, and they're going to tell me about, you know, their aunt who had diabetes and died, but it was her fault, she didn't really look after herself? Or is it going to be an opportunity to have a conversation about, you know, about diabetes in a really respectful way? And you know, hedge your bets. It can go either way.
Right. Yeah. CJ, what else? What were you thinking?
I mean, for me, and just type 2 diabetes, the community gets a lot of stigma towards it. And I've been fortunate enough to be able to have a great relationship with my healthcare providers as a whole. But just the different stories that people share in the online diabetes communities. And, you know, it's like Abbott Diabetes has a certain look. So for example, with type 2 diabetes, you know, if you're obese, you're automatically a type 2. And if you're thin, you're automatically a type 1. And me personally, I have been, some people have thought, but I was a type 1 just because I have a thin body frame, which that isn't true. You know, anybody can get type 2 diabetes. It doesn't have a certain look. And I think as far as like with language, we have to eliminate the stigmas first.
right. Joy, I see that you've gotten to join us. So excited. Hi, why don't you introduce yourself and join us with the conversation. Our question we were just talking about is why language is critical.
Yeah, thank you
to
guys
all of us.
so much for inviting me on. I had a little snafu in terms of time zones. So
Sure
I'm glad to be here. And I did catch your comments, Sarah, and also Renza's comments and CJ's. And I am a certified diabetes care and education specialist, and I became one because many people who I live and love very, very dearly have the condition and are living with the diabetes type 1, type 2. And so, and I saw that, you know, that leads me into this question that you just asked me, why does language matter? Because as a kid, I saw my family members being disrespected, right? And being sort of belittled and questioned about their dedication and their motivation to self-care and to health. And even as a child sitting next to a family member while they were in a doctor's office, I could feel that it wasn't a safe space to talk about you know, your concerns, or a safe place, a trusted place to talk about your hopes and dreams related to your life and how your health is associated with that. And so for me, the fact that language didn't matter then very much shaped my desire and my passion right now to make sure that the language we use when caring for people is one of empathy, and one that creates a safe and wonderful space. And, you know, Renza, you were saying earlier that, you know, Australia changed, you know, launched Language Matters, and that there is evidence-based practice behind that. And, you know, there is, you can read a lot of different scientific research that tells you that the empathy that a person feels when sitting across from their clinician very much helps to determine the course of their diabetes journey. And so for me, I want to be that empathetic clinician that helps guide a person to the journey wherein they live their best life and they feel the best and they can do all the things with their family members, because I don't feel that that was provided for my own family.
So important. Would you tell us just a little bit about where you are and where you work, what you do now?
Yeah, so I am, I'm embedded within a women's health clinic here in Houston. I work for UT Physicians, McGovern Med School. And so I have the very lovely opportunity to live with moms, not live with, but to live in a clinic in a space with moms who are beginning a new journey, right? Living with diabetes, who are very much afraid, perhaps, and a little concerned with what is going to happen. And so I don't need to add on top of the burden of concern during pregnancy. I need to help allay those fears and to, you know, to be there as a support system and open to accept everything that she might tell me so that we can come up with solutions and share decisions with herself and her clinicians. So I get to work with fantastic maternal fetal medicine physicians. And because we're in a med school, I get to model behaviors for new physicians that are coming up.
Oh my goodness, that's fantastic. Thank you. I'm so glad you could join us and be with us.
I'm glad to be here.
Okay, so let's see. The next question, official question we have is about acknowledging the wide range of backgrounds and experiences that we have among our panel right here. And could each of you share about a time or a first time or any time you experienced a hurtful or harmful comment that negatively impacted you and or your perception of diabetes?
I think I've already talked about it earlier, but I was in an online diabetes community for type 2 diabetes. And one question came up about obesity and the link to type 2 diabetes. And when I explained to them, well, that's not my case, my case was totally different. Then the moderator proceeds to say, well, I hope you don't have type 1. And I'm just like, what? And, that really triggered me a bit because, that automatically assumes that you're type 2. And then just to imagine those, who are dealing with obesity and they're not type 2, they're type 1. So that really shifted my thinking quite a bit. And, it's something that I don't want anyone else to experience. So that's one of the reasons why I do what I do, is to encourage people and, to let them know that, the language that you use is very important.
For sure. Renza, how about you?
We recently had, a terrible show on TV, Australia's Health Revolution. And it was presented by I think he's a GP from the UK, so came to tell Australians that we're all unhealthy. And I actually wrote a piece about it because I was just so upset at the stigmatizing way that he was speaking about type 2 diabetes. And so this isn't actually something that necessarily was, that I felt was aimed at me but it was, because I feel like we have this, we are a diabetes community. I don't subscribe in any way whatsoever to my diabetes is worse than yours, or my diabetes is more complex, or my diabetes is more important, or diabetes sucks, like bottom line, and all diabetes is serious. So, the fact that he was being quite stigmatizing a lot of what he was doing towards people with type 2 diabetes, to be an ally, it's not good enough. And I really felt that this oversimplification and this real blame, this constant blame. And I thought, what is this achieving? I mean, who is possibly going to look at this and think the way that he's talking about a condition that I might have or that I do have, this stigma, what's going to make me go, gosh, I really need to go and talk to my doctor about it? Because he was a TB doctor, somebody who should know better, using language that just, was telling people to get off their backsides and fix this. Why would you think that going to your GP was actually going to be something that was going to be a positive and supportive experience? And I feel like, this image problem that diabetes has because of the way we've communicated about it for so long. And when I say we, I work for a diabetes organisation. We have to take some responsibility from some of it. We're really good at it now, I've got to say, because we talk to people with diabetes. But oh my goodness, we've run some campaigns a long time ago that were not ideal. They were all about personal responsibility. There was no looking at what are people's situations, and just this blaming and shaming constantly has set us up now that we've really got to dig ourselves out of this hole that we have, the people with diabetes and that diabetes is in. But I feel like we need to be having these conversations and pointing out why this is more than just political correctness. It's not about being politically correct. It is about so much more than that. It's about changing attitudes so that people understand how serious this condition is and why we need to be taken seriously. I think I just totally went off question. Sorry.
No, you did not. You were just totally perfect.
Yeah.
You were just exactly right. Yes, Joy. Yeah.
And to continue on that, because it was right on target. It's like, I was like, Spine, say that more. Is the language that turns into like non-compliance, right? So we've had this, for me, it's a trigger word. It's a very strong trigger word, because I don't don't feel that, you know, if someone has made the steps to make an appointment, navigate traffic, Houston traffic, y'all, is is a monster. Like just getting into your car, you have to kind of like, whoosah, I can do this. And then you like in it and you're in it for hours. And then you navigate one of the largest medical centers in the entire world. And then you end up in like a parking garage. You have to cross underneath, cross the valet, find the elevators that actually go to the right floor, not the ones that go all the way to the top, but all the one that goes to the middle. Anyone who is doing all of this has an intention to get well. Like they're chasing, you know, assistance, and they want resources and they want help. If they've come this far, if they've made it the past 2 hours through all of that in order to sit in front of you, this is not a patient that falls into this category of non-compliance. It just drives me bonkers.
Yeah.
And so anytime you tell a person that they're non-compliant, or you use language that is demeaning, or language that tells them that they're not doing something that they really should be doing because you told them that. I saw like maybe like you know, one of those catchphrases or something on LinkedIn or something that said, non-compliance is a one-way street to a dead end. And so from that moment, when a person comes in and they've come at you with all of this energy and all of this determination to get to sit in front of you as a clinician, and you say that you've been non-compliant and you haven't, that is a roadblock immediately. There is no way to get back the trust, because someone came with such positive emotion and desire and want and motivation, and you stop them immediately. And there's no way to come back from that. Like you've lost trust. You've dug yourself this hole that Renza was just talking about. And how are you gonna get out? You know, you want to meet all of that enthusiasm for improved health and care with the same enthusiasm of, I am here for you. I want to know who you are, how we can personalize your care, and we want to make this journey together. What is it that I can do for you? Let's go. And that's a completely different trajectory of trust and empathy and care between your clinician or your support person or your community health worker, whomever. It's a completely different experience. So,
well, and you know what, I just felt myself, as you were saying those last few statements, I just felt myself getting like motivated and excited. Like, yeah, exactly. Like, talk about what I can do and what I can choose, and involve me in that, and yeah, let's go. Like, it's a very positive, like invigorating way to thing to hear and way to feel. And how incredible to think about hearing that and feeling that in a healthcare provider's office. Like,
I know that as a patient, you know, I would like to be told, you know, exactly what am I doing right, you know, encourage the patient, and then just talk about, you know, what things they can do to improve.
Yeah. And sometimes, you know, what I find is, because people have had such negative experiences, it's hard to even, you know, you have to push a little bit harder to get through, because they may not have come with as much enthusiasm as they would have if you were the first person to say, I'm going to help you, and then to follow through. Like, your actions have to meet your language. So my patients know that if I tell them that we're going to go fight some insurance like coverage issues, they know that I'm going to fight some insurance coverage issues, because I tell them that I will. And then whoops, I'm sorry, I'm so excited. I'm like throwing it on my desk. I tell them, look, they're like, well, you know, I think that I might be covered with a CGM, but my insurance says that, and I need all this paperwork. I was like, oh, they're just finding hoops for us to jump through. Let's jump them. Like, they're rainbow colored hoops. Let's do it. And they're like, okay. I know she's saying this, but will she actually do it? And then there's a surprise that it's been done because I said that it was done. And so I think that, you know, not just pretty words of encouragement, not just pretty words of support, but do the work to make the support happen. And, you know, it's become a lot easier for me to do that. I know it sounds like a lot because insurance here in the States are probably just as bad as the traffic. And so, if not a ton worse. And so you have to do a million things in order to get one diabetes resource or one diabetes medication to a patient. So even if you've come up with this plan, with this treatment plan, that's, you know, a shared decision-making plan, the doctor agrees, the patient agrees, the educator agrees, the supporters agree, you may find difficulty in getting the supplies for someone. And so I have made it my job to fight the fight for people, to let them know that we're going to fight it together. But then this amazing thing happened this summer, y'all, that I have to tell you. I went to my leadership and I said, look, these are all of the things that we do. This is how much time it takes, but this impacts patient outcomes. And it also helps patients to do the things that they want to do to make themselves better. And they were like, what do you need? I was like, I need an assistant who does prior authorizations and fights insurance companies with me and for me, and then can follow it through the process so that I can continue to take care of more and more and more patients. And they said, drum roll, yes. So I have this amazing, like, we still do it because we're diabetes care and education specialists, and we can, and we should, so that we keep our skills up because everything changes all the time. But she has created standard operating procedures for acquisition of diabetes resources, especially in challenging insurance cases. And what that means is a patient can come in and say, you know, I would really like to consider technology. And we can dive in and dig in and figure out how it's covered. Is it a pharmacy benefit? Is it a this benefit? Is it that? So we can make all the language that we speak that means something internally to us and externally to the patient. We can put our actions where our words are. And so we can help them. And there are very few cases where we just cannot. It may take several days, several weeks, and a physician's call to the insurance to do a peer-to-peer, but we will do all the things that we said we would do.
Oh my goodness, that's incredible. Yeah. And I think you leapt right in and went with where our next question leads or is going. So I'll ask it still because I think both CJ and Renza have great things to say for that as well. But talking about positive experiences, and let's talk about times when a healthcare provider or someone else framed something for us that allowed us to take something positive away or allowed us to think differently about chronic illness.
Can I talk about my endocrinologist, who I've been seeing for 20 years this month? Yes. Poor woman. She knows she's not allowed to retire until there's a cure for diabetes. So probably another 5 years or something, I guess. But okay, so I start by saying her middle name is Joy and my daughter's middle name is Joy, and my daughter is named for her. So and obviously you too, Joy, on this Zoom. So when I started seeing her, oh my gosh, my diabetes were like, I didn't even want to think of diabetes, and my mental health was really very shot. So two things. The first thing she said was, we're not going to talk about diabetes. Have you ever spoken to a psychologist or anybody about living with diabetes? And I said, no. And she said, let's do that first, because I think that's really important that we do that before we start to talk about diabetes. And it completely framed the way I thought about diabetes differently, because she took it away from just being about numbers and what my A1C was and whether I was a good or a bad diabetic. And it actually came back to me being a person. So that was the first thing that she did that I realized she was a keeper. But at the time, I was really struggling. I was struggling a lot. I was barely, you know, I hate that, you know, that thing about people with diabetes, they're in denial. We're not in denial. We're still thinking about diabetes, even if we're not doing diabetes. But she knew that I wasn't checking my glucose. You know, this was before there was no CGM in Australia at this point, and she knew. I probably told her because I felt like I could be honest with her and she wasn't going to judge me. And she said to me, how would you feel about doing checking your glucose when you wake up on Wednesday mornings? And I said, all right. And she said, let just that. And I said, okay. And, you know, I really was, I had a glucose meter that was languishing down the bottom of a bag somewhere. I couldn't tell you the last time I pulled it out of there. I was still giving myself, I was on a pump, so I was still getting insulin, but I don't know what I was doing. And I said, okay, so you want me to do what? You want me to do one blood test a week? And she said, yeah. And I said, doesn't that sound pointless? That seems like really pointless. She says, one is more than none. And, you know, it seems like such a ridiculous thing. One data point. What was that doing? But of course, it wasn't one data point. It became two, and it became me realizing that it was just a number. It wasn't a measure of who I was as a person, because that's how she started framing it. And now I know everyone wants to see my endocrinologist, and you can't because she's in Melbourne, and probably too many of you are. But she's truly, you know, it's that thing of when I walk into an appointment, she never says, how's your diabetes? It's, we have a good discussion about what else is going on in my life before we get to talking about diabetes. And, you know, that's why that communication piece is important, because it's not just about words, it's about framing things. And she frames it that diabetes is one part of my life, a part that I don't particularly like, and never the most important part. And she gets that. And that's, you know, that makes sense to her too. I adore her. I love her.
Yes. Brilliant. That's so awesome. CJ, how about you?
So there's two that come to mind. So when I was pregnant with my last child, I ended up getting gestational diabetes for a second time. And at that time, when I found out that I had gestational diabetes again, I was depressed. I was depressed because I was doing everything that I could to prevent it, but yet, hey, here it is. So my doctor at the time, she realized that I was going through, you know, some things, and she actually had me to stay overnight at the hospital and to speak with a psychologist the next day, you know, just to talk to her and kind of see, you know, to see what was happening with me. And at that time, I was diagnosed with depression and generalized anxiety. So with that, we were able to work out some things, especially when it came to testing blood sugar levels. And, you know, she really wanted to make sure that I had a healthy pregnancy, and then also just that my mind was right. And I really appreciated that. So it's just, you know, when you find a doctor that is really attentive to you, you know, that was a true blessing.
Yes.
And then my endocrinologist now, it's almost been a year since I've been with him. And he's kind of like a father figure. So, you know, when we have appointments, you know, it's just like talking to a father. You know, I can talk to him about anything that's going on. And like recently, I had a question, and, you know, he was able to contact me separately, and, you know, we talked about it, and now we came up with a plan. So I've been really blessed to be able to have attentive healthcare professionals in my life. So, yeah.
Yeah. It's interesting to me, though, listening to each one of us and thinking about my own story too, and thinking that how wonderful would it be if it wasn't let me tell you about this one amazing healthcare provider and this one endocrinologist, because I have one too, and I'm very glad. I'm very glad to, and I'm very glad for all of us who have that story. But also, if that wasn't the exception, or if that wasn't the exception that we expect, but that it was, you know, worldwide, everywhere wide. My specific example is thinking about the positive thing. And for me, so I was diagnosed when I was 7. And from that time until probably my mid-20s, every single interaction with a healthcare professional was not only about, you know, type 1 diabetes and insulin and everything around that, but also around, you must lose weight. So that started when I was 7, and, you know, went continuously. And it was ingrained in my head that I needed to be losing weight, that I weighed too much, that whatever else. And when I was in my early 20s, and I saw, you know, a number of different doctors for diabetes throughout that entire time. And when I was in my early 20s, I went to see a new one, one with, you know, very wonderful reputation and very, you know, credible and well-known and whatever else. And he said, well, I won't see you until you lose weight. So telling someone with type 1 diabetes that, and he said, you know, you need to lose at least, you know, 20 and 25 pounds. And so don't make an appointment to come back until you've done that. Now, sometime after that, I met and was started to see the endocrinologist that I'm still seeing now, and he can't retire either. and that's where we are, some like almost 40 years later. And he said, and I can remember it, I hear it in my head, we can treat your diabetes right now at the weight that you are. And it would be helpful if you lost some, but we're going to help you today. And I burst into tears and I cried, and I still feel like I would, like, right this moment, because that was, I see you, I hear you about what's going on with your life, but you deserve treatment and you deserve to be taken care of, and we'll do that for you. We'll do that with you. So how incredible. And Joy, I get the feeling from you and from your stories that's your type of care, and that's who you are as well. So I just want to recognize that as well.
I think it's the only way to be. I honestly can't. I mean, maybe it was so formative as a kid, but like that, you know, those moments where someone said to my loved one that they weren't enough, that they didn't hear them, they didn't see them, like that's what translated in my youth mind. And so I, you know, I endeavor not to be that person that sets that path, you know, for someone's journey.
Yeah. And you get to play a role with the students and the incoming and the new providers, which is so incredible as well.
And hopefully they feel that way, you know, when they go into practice, they remember the things that we modeled and learned together, so that there's more of your wonderful endocrinologists like in the world one day.
Yes, we need them. We need them.
Yes, for sure. All right, so moving a little from the individual or the personal into kind of larger and broader maybe. And as people living with diabetes and people working with people living with diabetes, how can we continue to shift the narrative about diabetes and talking about it, and what gives us hope that we can do that?
Can I say something that's going to make me probably a little bit unpopular with some of the people who are watching? Because I did just sneakily have a little look at some of the comments. And I'm going to preface this by saying this is my opinion, and I speak for no one other than me. However, I do want to address something that's come up a couple of times, and that is changing the name of diabetes. Why type 1 and type 2 diabetes? Firstly, there are not only type 2 types of diabetes, there are lots of types of diabetes.
Exactly.
But the thing that seems to keep coming up is why should we be called the same thing? And there is usually an undercurrent in there. And I actually, let me go back a step and say there is a photo of me that no one will ever see. It used to be on my Facebook page, but it's deleted from there. And it's me standing there in a red t-shirt, looking a bit smug. And I'm wearing a t-shirt that has written on it, type 1 diabetes, the real diabetes. I'm so ashamed. I'm so ashamed that I was wearing that. I will say it was like 15, 16, 17 years ago now. I thought it was funny. I thought it was sassy. I thought, how cute is this? Because I had a very wrong opinion of people with type 2 diabetes and type 2 diabetes, full stop. And then I started talking to people with type 2 diabetes, and oh my goodness, gosh, didn't my opinions and horrible attitudes change? Why do people want to change the names of diabetes? People say they're different conditions. Well, they are different conditions, which is why we have type 1 and type 2 diabetes. They're named different things. And I genuinely believe that people should know and have a right to know which diabetes they have, because there are lots of different implications about that. Type 1 diabetes being an autoimmune condition. My family collects autoimmune conditions. I'm the only one with type 1, but knowing that I have an autoimmune condition kind of makes sense when you look at, my mum and her conditions and her sisters and the other autoimmune conditions I have. So absolutely, we should know which condition we have. But
Absolutely.
why? What is the psychology behind people saying, I don't want them to be the same thing? And usually the language is, I don't want type 1 diabetes lumped in with type 2 diabetes. We're talking language, that's horrible language. So I don't believe that we should change the name, because actually there are a lot of similarities as well as there being differences. So, there are similarities. Also, can I just say, as somebody who works in policy and advocacy around diabetes, in Australia, there are only 120,000 people with type 1 diabetes. If you think we would get any attention at all from government, from policymakers, from research funders, because talking about that number of people wouldn't happen if we were able to also talk about type 2 diabetes and the impacts of type 2 diabetes and how they can be similar with type 1 diabetes. Complications can be the same. We know that. But also, I think we need to look into the community to see why we have these opinions about not wanting to be lumped in together. It is terrible. So when I talk about type 1 diabetes and people often say, what are the differences? I'm so careful about that, because the way that we have done that in the past, and I just want everyone who's watching and everyone on this call, because I bet we've all done it at some point. Type 1 diabetes is an autoimmune condition. I couldn't have prevented myself from getting it. I couldn't have done anything to stop it from happening. That's all factual. It absolutely is. Type 2 diabetes, it's a lifestyle condition. People are usually overweight. Blame, blame, blame. It doesn't talk about modifiable risk factors. It doesn't talk about cultural impacts. It doesn't talk about people living in food deserts. It doesn't talk about poverty. It doesn't talk about disadvantage. All things that are very, very relevant to a condition like type 2 diabetes. All things that are really relevant actually to the outcomes of people living with type 1 diabetes as well, mind you. And also think about this, those modifiable risk factors when we're talking about type 2 diabetes. So modifiable risk factors like watching what you're eating, being more physically active, all of that sort of stuff. Same modifiable risk factors as for breast cancer. Tell me when the last time you heard a woman with breast cancer being blamed for getting her condition. Never. We should never do that. We should never do that. Equally, we should never blame a person for developing type 2 diabetes. So when we are saying, I don't want to be lumped in with that, we are contributing to that stigma. So when we're talking about what we can do at a bigger, community level, one of the things that we can do is be allies rather than throwing our brothers and sisters with diabetes, with type 2 diabetes under the bus, because I don't want people to think that I'm unhealthy. It's so stigmatizing. It is so counterproductive. And I'm ashamed that I used to think like that. I'm very grateful that I don't now. And I'm so, so grateful to the people with type 2 diabetes. They don't owe me a teaching moment, but I'm so grateful to the people who showed me how wrong I was. Probably people don't like me now. I'm not even going to look at what people are saying just in case they all come at me. Anyway, be quiet now.
I think,
Can I get an amen for that?
Well, I'll just say, I think I think what you've just described and what we're all kind of living in the middle of is this connection between good and bad, and healthy and unhealthy, and associated with various behaviors or traits that people think are either good or bad. I mean, and associating that way, and then communicating, talking about these various things that way. So, I mean, if I said I was a bad diabetic today, you all would have, we all would have assumptions about, but we would have them, and probably a lot of them would be similar, because whether or not we think of ourselves that way, we've all learned to think of what a good diabetic or a bad diabetic, or a good blood sugar number or a bad blood sugar number, or all of these things. And it goes along with, you know, well, I ate healthy today. Well, I ate good today. Well, I, you know, whatever. And this real sense of morality of people being good people or bad people because of conditions that we live with, and or, you know, behaviors that we did or didn't do. And it's tiring. It's really tiring as one person living within that, but then also with knowing about how it is on a broader level. CJ, you're nodding your head. What do you think?
Yeah, I absolutely agree. And I want to add, you know, really, in order to eliminate those stigmas and the separation between type 1 and type 2 is just knowledge. Just being able to research what diabetes really is, find out those types, make sure that you're correctly diagnosed, which is what I'm personally in the process of doing myself now. And keep sharing your stories. And as an advocate, just be an example. Be an example. You know, so, you know, the knowledge that you share, make sure that it's accurate, and make sure that the language that we send to our communities are respectful and with dignity. So I think that it all really comes down to knowledge and being an example, sharing our stories.
Thank you. Yeah, I think for the you know, 34 million-ish of us in the US and the 422 million-ish around the globe, the idea that every single one of us deserves respect and medical care and appropriate treatment and access to taking care of ourselves and to care for ourselves is huge. It's like the big numbers to go exactly with what you just said, CJ, around our stories and ourselves. Yeah. Joy, did you have something?
Yeah, and I want to say to both CJ and Renza, I think what you both just said about create, you know, like avoiding a dichotomy, right? Like making something that's like one condition better than or less than another, and using knowledge to improve upon that. I think that even as clinicians, every day is a learning experience with our patients. And as we support them, learning the challenges that they're experiencing individually. And then that increases, you know, our experiences, because I'm not living daily with diabetes. Yes, I love people who live daily with diabetes, but I myself don't live daily with diabetes. And so to have the knowledge of someone who has, you know, what is it, 525,600 experiences in the year, right? My kids and I were just watching, listening to Rent. But like all of these moments that they live with diabetes, and they're learning their diabetes and how their diabetes reacts to activity. Because not everybody's diabetes with physical activity makes for a number that is more desirable. It may make for a number that's very challenging for you and makes your life that day very challenging. And so learning this, you know, you can have all of this book learning. Like my dad used to say, you can have all this book learning, but you didn't live the experience. And so when you do that, you can start to shift your views, right? You can start to shift the way that you think away from good, bad, left, right, straight, backwards. You can start seeing the grays, and you can start seeing the different variations and shades. And once you do that, I think you can move yourself, and we can, as a huge world community, start shifting the needle away from saying, I'm different than this person and therefore it's better or worse. Or, you know, I think that knowledge allows you to see those shades within, and then allows you to accept them and to expect them, so that you don't train your mind towards those stereotypes and assumptions.
This is a complex condition and a complex disease, right? That we're the diabetes with the big D and all the types within it. And we're complex people. So there's so much to learn for sure. Yeah, Jordan, I'm seeing the time, and I am have to say, I'm not sure where to go from here, or if you want to yeah.
Let's take one more question, Sarah. How about that?
Okay. Let's see. Oh, this is a good one. Let's see. So question from Facebook. We are exactly 1 year into my son's diagnosis, and he's 4 years old. Any advice about how we can talk about diabetes to help his peers support him with positive and respectful language as he grows and as we learn? Anyone? Everyone?
So I guess I'll go first. I watched a really wonderful webinar today, a lunch series that the ADA here in Texas sponsored, and Dr. Daniel DeSalvo is a fantabulous pediatric endocrinologist, and he spoke today about inviting the kids to have open conversations with their friends on the level that they are. So say for, one of the other panelists was 12 when she was diagnosed. And so she would tell her peers that, that the reason that she went to see the nurse before lunchtime was because she had an organ in her body that didn't function properly. And there are some things that certain age groups can learn in diabetes camp that can help them to sort of verbalize the things that they need to say to their friends, because oftentimes it's because their friends don't know, right? So their friends may not have encountered anyone who lives with diabetes, and they just don't understand. And so he invited parents and clinicians to have conversations with the kids on their level, and then have the kids be sort of prepared with an explanation, like, this is my technology that helps me to control my glucose values, and that would be, you know, a kid who's a little bit older, but another kid might say, like, this allows me to have the things that I'm eating, you know. So I think it's a really great webinar if you guys want to check it out. It's on the YouTube American Diabetes Association website, and today it was this afternoon at lunch, and he is just so fantastic. And Haley May is one of the diabetes advocates that was on there as well, and they had a lot to say around the PD community. And so for the viewer who asked the question, I think that can be super insightful for you. They covered the gambit from, you know, from the fear that kids experience to the support system, and what your support system looks like and how to progress through adolescence with that. And it was a really, really nice piece. I don't work specifically with PD patients, but I felt like I earned a lot of information about it as well. And I forwarded it to some friends that I know who are beginning their journey with their kids.
Yeah, that's incredible. Thank you. Thank you for that.
I think there are two parts to that. So the first part is obviously, you know, age appropriateness is really important. And I would look to see if there are any books out there. The one book that I could think of was, there's a great book that Dana Lewis wrote called My Aunt Has Robot Parts. I can't remember. It was something like that, but it was also just so I don't know, you know, it's a good one, especially for kids who are using pumps and wearing CGMs. It's a kid's book, they're gorgeous illustrations, and it's really very lovely as a way to explain what the devices are in a, you know, lovely age appropriate way. It's called Carolyn's Robot Relative. That's what it's called. So, you know, I think that finding, you know, pictorial stuff is probably a really good way to sort of highlight and point things out. But there's something else that I just want to think about, and this isn't actually necessarily just for kids, this is for everybody. How many times and how frequently do we talk about diabetes doesn't stop me, I can do what everyone else can, and we talk about normal, and, you know, and I don't like that word either. And I think there's a really fine line that we tread around that, because I you know, a child with diabetes should have every opportunity that their classmates have. They should be able to participate in exactly the same way. They shouldn't be told that they can't do sport. They shouldn't be told that they've got to have their parents sitting there the whole time, that can't go to camps, whatever. So genuinely believe that children with diabetes absolutely should have every opportunity that they would like to have, as their peers do. But I think we do need to be really careful about minimizing what those impacts of diabetes can be, because I feel like sometimes it can set up a child, and I know that it certainly I was diagnosed as an adult, but it set me up being told that diabetes doesn't have to stop me, when actually there are times where diabetes in that moment does stop me. And it made me feel really weak and hopeless if I couldn't just push through. But, you know, I'm hypo, I've got to deal with that, or I'm high, I've got to deal with that, or I'm having a bad diabetes day, I've got to deal with that. And that doesn't mean that I'm not normal, or whatever word we want to use, but diabetes does have an impact, and it does stop us sometimes. So being able to communicate that in a way so it gives space and permission to a child to know, actually right now I have to think about my diabetes, and it means that I might not be able to play. That's okay. It's perfectly okay to do that. And you can pick it up when you're feeling ready to do that. So I think that's probably more about the communication that around, you know, to the child who has diabetes, not just to the peers. But as for the peers, I would definitely say find some great books with pictures, and also be really led by the kid with diabetes as well. Let them tell their story to their friends. I think that that's really important too.
Yeah. CJ?
Yes, so I absolutely agree about age appropriate. I have 3 kids, and you know, it's different for me because I have to talk to them about my own condition. So finding videos and books, you know, to help them figure out, you know, to learn what diabetes is, and just giving them that knowledge in words that they can understand and comprehend.
Yeah. Oh, I agree with all of that too. The word that keeps coming up as I'm listening to the other panelists talk is a sense of curiosity around diabetes overall. And for me, thinking about growing up with diabetes, I wish that it had been broached to me or presented to me as being curious around numbers, right, around blood sugar numbers or any other laboratory results, and curious how that happened, and curious what my body did or didn't do, and curious what impact various things, various choices I might make would have, whether to eat or not eat, or, you know, exercise, not exercise, whatnot. Of course, at the level that our kids are, but I think about that with us as adults as well. You know, like it's a much easier frame of mind. It's not easy, but it gives my mind ease to think about, oh, I wonder why that is, and then I wonder how I could find out, or, you know, who could I talk to about this? That kind of sort of open wondering, as opposed to yeah, the whole dichotomous good, bad, blame, shame kind of business that we're working our way out of, and changing the world to shift away from that. So thank you all so much. Thank you to every one of our panelists, and thank you to Beyond Type 1 and our sponsors. Jordan, do you want to take it away?
I will. Thank you so much, Sarah. Thank you to all of you tuning in tonight, and thank you to this incredible group for sharing their experiences and expertise with all of us. I feel like you all could talk for days about this, and we would all happily watch, honestly. But we certainly covered a lot of ground tonight, and we are so grateful. For all of you watching, we have one more community table conversation coming at you this year from Beyond Type 1. You can actually register for it now. We'll be talking in December about the golden years and living well at any age with diabetes. It's going to be an awesome conversation, and one we're looking forward to having. So be sure to stay tuned into Beyond Type 1's channels and be on the lookout for new content highlighting takeaways from this conversation. And again, this wonderful group of panelists. Once again, we just want to take the time to thank those who make this all possible. Community Table is presented by the JDRF-Beyond Type 1 Alliance and made possible by Abbott Diabetes Care, Dexcom, Lilly Diabetes, MannKind, Medtronic, Omnipod, Roche Diabetes Care, and Tandem. Thank you again to this amazing group, and we will see you all again at the next community table. Have a great night.